Hi, my name's Mercedes. I'm going to be your nurse today. Can I just get your name and date of birth? Great. And today the doctor sent me in so that way you can get medications and feedings through an NG tube. And 3 reasons why you might have that is because of toxins, nutrition, or a bowel obstruction. But today, again, you're just getting it for feedings and medications. Do you have any questions, concerns? All right, so just kind of a small rundown on the procedure. I'm going to ask you to drink some water, and every time that you swallow, I'm going to insert a tube through your nose, and it's going to be about 5 to 10 centimeters each time that you swallow until we get to how far we need it done. And if you feel any discomfort or pain during the procedure, just kind of raise up one of your hands to kind of signal me to let me know that you have pain or discomfort. Alrighty, so now I'm going to perform my hand hygiene. And I'm going to don my gloves. Now I'm just going to take this tube and I'm going to measure from the tip of your nose to your ear, down to the bottom of your xiphoid process, which is about 50, and I'm going to mark that with a piece of tape. Set that down. Pause it. So now that we've measured the tube, I'm going to have you tip your head back a little bit, and I'm going to insert the tube. Okay? And go ahead and take a sip of water for me, and swallow, sip and swallow, and just kind of keep sipping. Almost done. Alrighty. And now that we've got that done, how's that feel? Feeling okay? Good. We'll tape that up for you. We'll tape it to your shirt as well. Pause. And now 3 ways that you would check to make sure that the NG tube is in place is via aspirations, pH, or chest x-ray. So now that the patient seems to be all set, I'm going to go ahead and don my gloves and perform hand hygiene. And then I'm going to document what I've done with the patient. Hi, my name's Mercedes. I'm going to be your nurse today. Can I just get your name and date of birth? Good. And today the doctor sent me in to give you feedings and medication through your NG tube. Pause. Hi, my name's Mercedes. I'm going to be your nurse today. Can I just get your name and date of birth? Good. And today the doctor sent me in to give you a feeding and medication through your NG tube. And I've already went over my 6 rates of administration for medication with my patient. I also checked my MRA twice to make sure that it's good, and I'm doing my 3rd check for the medications at the bedside now. Can I get your name and date of birth one more time? Great. Pause. So now that I've checked your vital signs and everything looks good, we're going to go ahead, and our medications are already crushed. And I'm going to go ahead and perform hand hygiene and don my gloves. And the first step that I'm going to do is go ahead and check how much feeding is left in your stomach from your last feeding. Alrighty, looks like you've got about 30 mils. That's good. We can go ahead and give your next feeding. I'm just going to flush that really quick. Alright. Now we can go ahead and start giving your medications. Take this back over. And give the med with gravity. Wait for that to go down the tube. Right. And then we'll take sterile water and pour that in. And then give the second med, still with gravity. And then flush that again with sterile water. Alright. Take that off. Pause. Alrighty, and now that we're done giving you your medications, I'm going to go ahead and set you up to your feeding. And I've already double checked to make sure that it's at the dose that the doctor wants. So we'll grab that for you. Pick that up. And then we're going to push start. And if you have any questions, let me know. I'm going to go ahead and don my gloves, perform my hand hygiene, and I'm going to document when I've done with the patient. Hi, my name is Mercedes. I'm going to be your nurse today. Can I just get your name and date of birth? Good. Alright. And today the doctor's ordered for me to take out your NG tube. But before I do that, I kind of just want to listen to your bowels in all 4 quadrants and make sure that everything sounds okay. Alrighty, everything sounds good. So now that we've done that, I'm gonna go ahead and perform my hand hygiene. I'm gonna don my gloves. And for this procedure, while I do this, I'm gonna ask you to hold your breath and tip your chin towards your chest. And we're just gonna pull the tube out while you hold your breath. Alrighty. We'll undo this tape for you. Alright, go ahead and hold your breath. Alrighty. Discard that within your waste container. Don my gloves. Perform hand hygiene. Everything seems to be okay? Feeling alright? Great. And now I'm just going to document what I've done.